Hi, good afternoon, guys. I've got Gia here, UAE laser and beauty therapist. So she's thankfully come and joined us for some question and answers today. So I've got a few questions for her that you guys sent me, and also some that I prepared for myself. So thank you, Gia, for joining us. So basically, the first question that I've got for you today is, what are your main treatments that you do?
So I do all kinds of hair laser removal, laser bleaching, hair laser bleaching, and skin resurfacing using laser, chemical peels, Dermapen, acne treatment, pigmentation, rejuvenation, cellulite treatment, and fat loss.
Okay, and what training have you had in order to be able to do these treatments on people?
So I studied at the International College for Beauty Arts and Sciences in Los Angeles, California. And then I took the state exam and became a licensed esthetician by the state of California. And then I moved to Dubai, the UAE, and I took my laser course with Sultark in the University of Sharjah. And then I applied for my hair laser removal license through the DHA. And then just last year in 2020, I went back to school and joined the Institute for Medical Aesthetics, and I upgraded my license to laser therapist. So I've learned how to use laser to remove veins, tattoos, use it for skin resurfacing and skin rejuvenation.
Okay, so what clinic can we find you in now if somebody wanted to come and see you?
Sure. I am in Novomed, 3 days in 3 days in Novomed Estetica in Sakaim, across from Burj Al Arab, and 2 days in Marina Plaza.
Okay, so what does a normal day look like for you? So how many clients could you possibly fit in a day?
It depends on the treatment. So there are very quick treatments like hair laser removal for underarm or bikini, and then there are the large treatments or the long treatments that maybe is cellulite for the legs, back and front, and skin tightening. So if it's the big treatments that go from 1 to 2 hours, I can probably fit 4 to 5 clients. And then if it's one of those really tiny treatments, then I can do up to 16, 18 clients a day.
Oh wow, that's a lot. Okay, so
it's good money.
Okay, so what's the most popular treatment that you're seeing in UAE at the moment?
Because of the weather and the sun, a lot of ladies are complaining of skin discoloration or pigmentation, and melasma, of course. The heat can also flare all these conditions. So a lot of people are looking to whiten the skin, get rid of the sunspots, the sun damage, rejuvenate. Mostly these are the treatments.
Okay, and what is the most popular product that you sell, and why is that?
So the whitening treatment is highly in demand. Sadly, a lot of ladies have dark underarms or dark bikini areas due to they got burned during waxing or during a hair laser removal session, or from a lot of shaving. There are a couple of hair deodorants in the market that are also causing the skin to get darker in the underarm area. So we have a lot of treatments to, whiten this. But also, as I said, dehydration, so a lot of hyaluronic acid, vitamin C treatments are definitely in high demand. Okay. And cellulite, of course, for women.
Okay. In UAE, a lot of people suffer from melasma. What advice do you have for them?
Please wear sunblock. It's religiously, it's not a luxury, it's a necessity, and an SPF of 30 to 50. Sunblock that has an SPF from 30 to 50 is definitely recommended. All these 15, 18, 10 is not enough to protect you from the sun. Reapply if you're always outdoors or in the heat or in the sun. Reapply it every 2 hours. And remember that melasma is a condition that you have to always maintain and keep it under control, because it can never go away 100% completely, but you can definitely maintain it if you do the right things.
Okay. And what causes melasma?
It could be hereditary, or after childbirth, or after you turn 40. All of these things can, and sitting a lot in the sun. So all of these things can definitely cause melasma.
Okay. And for those of us that may not have knowledge of what is melasma, what does it look like? So if I was to see somebody that had melasma, how would I recognize it? So not medically, just aesthetically, what does melasma look like?
So it comes in a lot of forms, but the most common one is you could see two patches on the upper cheeks or lower cheeks, or sometimes it's just little brown spots next to each other that just go next to each other and kind of take a whole section of your cheeks. If you try to stretch your skin, it doesn't really stretch, they hold together.
Okay. Now, it's a question that a lot of people kind of don't know the answer or be misinformed. But for laser hair removal, how many treatments do you actually need for the hair to be completely gone?
So this is a great question, and I talk about this with my clients all the time, because normally the standard is 5 to 8 sessions of hair laser removal, but the key to a successful hair laser removal is that you stick to your treatment. So you come in every 4 to 5 or 6 weeks depending on how far you are in your treatment. And what most people do is go for the first 2-3 treatments, the hair starts getting thinner and lighter, and they get so happy, they ditch their session, they continue to shave, they disappear 3, 4, 5 months, the hair gets thick again, and then they go back to the center or to the therapist and say, what happened? You didn't
I'm a
give
lifelong laser customer.
No, you're using laser as a very expensive waxing method instead of, if you don't go, you're giving the hair a break and a chance to regenerate and get strong again. Because every time you do get a hair laser removal session, you're making the hair follicle weaker and weaker and weaker until it dies.
Okay.
When you give it a break, then you're giving it a chance to regenerate again and get strong again, and you're losing your money and your time.
Okay. What is mesotherapy for those who haven't tried the treatment, and what is it most effective for?
So mesotherapy is minerals and vitamins either injected into the dermis or applied topically using Dermapen, Dermaroller, and Dermastamp. The most famous one right now is the Dermapen because it's painless almost, and if some people have some pain, you can always apply topical anesthesia. And the Dermapen is basically an electric pen with 24 to 36 very fine needles that we go over the skin with that pen to open up channels in your skin so that the product penetrates deep into your skin.
So the product would be like a serum, you mean, or?
So usually the mesotherapy is, as I said, vitamins and minerals that are very concentrated and rich in active ingredients. So instead of just applying it topically on your most outer layer, your epidermis, this is something that you can do at home. What the laser or the beauty therapist would opt that you get the most of this vitamins and minerals by injecting it deeper into your skin. So she might go up to 1.5 millimeter or 2 millimeter deep into your skin so that you would see better results. Also, the Dermapen helps a lot with large pores, uneven skin tone, those really small fine wrinkles, because it causes a small trauma to the skin. And so your skin, to defend itself, sends elastin and collagen fiber to repair that small trauma, and the skin looks more plumped, hydrated, and just firmer.
And would that normally be noticeable with one treatment, or you need a course of treatments, or what would
So
somebody do?
it depends on what you have. I always recommend a course of treatment, at least 4 to 5. Once every 2 weeks is good enough. But of course, some people go get mesotherapy before a wedding or a party
For
with
like a
maybe
boost.
vitamin C. Yeah, it gives you like a nice glowy look and a glowy skin even underneath the foundation.
Okay, right. So we spoke a little bit earlier about people opting to buy products for whitening treatments. Now, do whitening treatments actually work?
Yes, they do. Yes, they do. It depends on what are you using and where are you going. There are a lot of treatments that work in the market. You can DM me and I'll tell you in detail.
Okay.
But there you can do chemical peels. There are some yellow peel is one of the most famous peels for melasma. You can do laser, pico laser or Q-switch laser. There are so many treatments in the market for melasma now.
No, whitening. Oh, whitening treatments for melasma or dark patches in the bikini
Both.
area or underarms.
Both.
Okay.
Home care and at the clinic.
Okay, fantastic. So we'll put your details with the video, and people can contact you for
Thank
advice.
you.
Yeah. Okay. Now, some people are suffering also from rosacea. So this was a question from one of the followers. Is there a product available to treat rosacea or make it more manageable? And if so, what is available for people that are suffering from rosacea?
So rosacea is also like melasma. Once you have it, you need to always take care of extreme weather. So very cold weather, very hot weather, alcohol, spicy food, sun exposure, all of these things can inflare your rosacea. It's mostly common around people with lighter skin shades and types, but some people with dark skin might have it. There are also so many treatments for rosacea right now. There's few treatments with laser. There are some topical creams as well, and also some, if it's very, very severe, then there might be some tablets, but that so you have to consult with your dermatologist. But yes, there are many treatments for rosacea, and it is a long life condition that you always need to take care of.
Okay. Coming back to something that I always ask the professionals that we have on, is that I'm very passionate about products, and those products that we recommend our followers. Now, is it a myth or is it actually true with the products that we can purchase from spas and salons and the clinics versus those products that we can get from the high street, say from Boots or Life Pharmacy? Is there a difference in the quality of these products that you're getting recommended? So when you go to a clinic and you're being recommended products from the beauty therapist or your esthetician, and the products that you can go in and just buy from Life Pharmacy, is there a difference in the quality of these products, in your opinion?
In my humble opinion, I don't believe that the more expensive the product, the better it is. I believe that there are lots of skincare products out there, and the skincare industry has been booming in the past 10 years. But the most important thing is that you know your skin type. So if you are somebody who has an oily skin or acne prone skin, buying more lotions or creams will only worsen your condition. Instead, you should be always opting for a gel moisturizer versus a lotion or a cream. A face wash that's not milky face wash, but rather a gel face wash with probably salicylic acid or maybe some glycolic acid. So it depends on your skin condition. If you know what your skin condition is, and the reason why it's better to listen to your dermatologist or your beauty therapist is because they can tell you what kind of skin type you have, what are the right products for you. But no, I don't believe that the products in a clinic are better than the products in the market. And again, just because something is expensive doesn't mean it actually works. There are a lot of products in the market that are cheaper, and they have good quality ingredients.
I think that's a fantastic answer. So would you say that it's important to follow the advice of a professional when purchasing products?
Definitely.
So make sure that you're following the right regime for your skin type.
Definitely.
Okay.
And exfoliate and use sunblock. Those are probably the most two things that I always tell my clients. You have to exfoliate this dead skin, otherwise you're just applying products on top of dead skin. And when you exfoliate, you also must protect your skin. This is not a luxury that you're doing for your skin. This is a necessity.
Okay. Right, as you joined us, which I'm very grateful for, and given us some fantastic advice, could you give us an example of one or two of your favorite products at the moment that you're using or you can recommend for us?
Sure. So I'm using this American brand called American Natural Blend, and it's currently based in the US, Canada, Saudi Arabia, and Iraq, but I think they are coming to Dubai soon. And their products are lovely. The creams are rich in ingredients. It's 84 to 85% organic product, so there is no chemicals in there, and it's mostly based in peptides and amino acid, which is what your skin needs to build itself and for your collagen to regenerate and to get that nice firming. I like it because you don't have to use a serum. I mean, you can if you want to, but the cream is really that rich in active ingredients that even just applying a cream can get you good results.
Oh, fantastic. Another question from one of our followers was, obviously a lot of we have a lot of parents that are following us, What age should they start at looking at giving their teenager or their child a skincare regime, when they should go from just a normal soap and water cleansing off the face to introducing skincare to their young one or teenager or child?
Sure. So sadly, once one hits puberty, whether it's male or female, a lot of teenagers are having acne problems. So the acne starts flaring, the hormones are imbalanced, so that's when you start to see teen acne. And sadly, most of the teenagers, they're very good at waking up and washing their face and applying the moisturizer, but then very few of them remember to wash their face at night before they go to bed, which is the most important one, because your skin repairs itself while you sleep. Once you turn 12, I would say 13, definitely start. If you are getting a lot of acne, then invest in a gel wash that is rich in salicylic acid or glycolic acid, and also opt for a gel moisturizer, not a cream moisturizer, so to keep your acne down. And then of course, if you can see an esthetician or a beauty therapist at least once a month, to get maybe a hydrofacial or just an acne treatment with some extraction to get all those blackheads, whiteheads out. And then she can also, depending on your skin condition, she can recommend other stuff to use. Sunblock, as I said, is a necessity. You must use sunblock every day.
Okay, so as soon as you start noticing, what about if it's not an acne, but you start noticing, because my daughter, like, she's 11 and she gets like these little pimply things, but it's not quite acne, and she's 11, and I have given her like a face wash and a moisturizer. That's an okay age to kind of introduce some skincare.
Yes.
It's not too young. I'm not damaging her skin in any way.
Not at all. You need to cleanse your face
anyway, isn't it? Yeah.
That's a given. And then you also need to moisturize, because while you're walking, while you're talking, while just sitting, there is something called the transepidermal water loss towel. You are using water and moisture from your skin constantly. So the reason why we always recommend that you moisturize your skin is that while that towel process is happening, you are losing the moisturizer and not the moisture in your own skin. Also, a scrub or an enzyme exfoliator to be used once or twice a week if you notice a lot of clogged pores. So that will help also with your skin cell turnover, because the older we get, the slower the cell turnover, and that's why by exfoliating, you keep that radiant looking skin, you unclog the pores, you remove all that dead skin, and then also you get more benefit from your moisturizer and serum when you're applying it on a fresh, healthy skin and not dead skin.
Wow, that was a lot of information, Gia. Thank you very much for joining us today. So we'll put Gia's contact details on this video, and you can find her, as she said, in Novamed. So please go and visit her there for your treatments. And thank you once again, Gia.
So much.
Thank you for coming and joining us today.
Thank you so much.
Take care, guys. Bye.
Bye.